Recently, policymakers in the United States have been exploring the possibility of redesigning the Supplemental Nutrition Assistance Program, or SNAP, as a nutrition-focused intervention. But throughout the world, many governments and non-governmental organizations have been moving food security interventions in a different direction. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Benjamin Chrisinger, an assistant professor in the Department of Community Health at Tufts University. Dr. Chrisinger has written a perspective article about SNAP and global evidence on food security. Dr. Chrisinger, what populations does SNAP serve and how is it currently administered?
So, SNAP is the largest anti-hunger and food insecurity program in the United States, and it's designed specifically to be broad and non-targeted. So it's focused on all households who would qualify based on income and other household characteristics. It's distinct from the more targeted programs, which focus on specific subpopulations, including children and pregnant people. So SNAP is distinctly designed to be broad in its focus and the types of households that it serves.
And then what are the primary criticisms of the program? Why have some policymakers, some scholars advocated for reform?
The way that I think about these advocacy positions for restriction is really kind of two camps. And one is more of a moralistic advocacy for restriction. And this is largely around the perception that participants are purchasing so-called luxury items. And this would be things like lobster or steak. And these bubble up in state legislatures from time to time, with lawmakers sort of suggesting that they should be able to restrict these items from the SNAP program. And this is largely a normative or a moralistic perspective. I don't really address that in the piece, but what I tend to focus on is the other big bucket of restriction advocacy, and this is from a nutritional perspective. And we see this coming from medicine and public health scholarship. And this focuses on the perception that folks who participate in the SNAP program are buying unhealthy food items. There's often a lot of focus on sugar-sweetened beverages and other so-called junk foods. So that's sort of the main camp that I'm trying to speak to in this perspective piece, to say that we need to take a broader perspective, even though we should be concerned about addressing health disparities in America.
So sticking for a moment with that proposal of restrictions on eligible items, how would that work?
That's a good question. And I think that's something that other folks who have written about the trouble with implementing restrictions have addressed. So I guess the hypothetical proposal is that these items could somehow be flagged. And then when folks are at the till to check out, they would need to tender some other form of payment for ineligible items, or they would just have to forego those ineligible items when making a SNAP purchase. Similar kinds of screening already exist. So folks can't buy non-food items with SNAP. So as many folks might have experienced, like sometimes when we're doing grocery shopping, we have things like toothpaste and toilet paper in our shopping baskets. And if we were using SNAP, we would have to, or we'd be prompted, usually by the person checking us out, to tender another form of payment because their systems would flag that as, well, this basket has ineligible items. And so they will need to offer up something else. So those systems do exist, but to actually scale it up to include nutritionally coded items would be a logistical feat in many ways. And some folks have suggested that this administrative burden to be placed on both participants and then also the accepting retailers who accept SNAP would actually be too complex to implement. I don't necessarily get into those complexities in the piece, and other folks have written a lot about that, but that is sort of the argument that's made.
And then what about other types of nutrition-focused reforms? What's being considered?
So other kinds of incentive programs have been piloted in SNAP. So the nutrition incentive program essentially gives a bonus to folks if they buy healthy items. So we've seen this around the Healthy Incentives Pilot, and which is now the Gus Schumacher Nutrition Incentive Program. So these pilot programs now been scaled up in different places. Say if SNAP participants spend the money on fruits and vegetables, for instance, that they'll get an extra bonus in benefits for buying those items. We see that those work. They do increase purchasing of healthy items, and it's a non-restrictive option to steer folks more in the direction of achieving nutritional aims. It's an incentive, it's not a restriction.
So you say in your article that these proposals, despite their admirable goal of alleviating health disparities, don't devote sufficient attention to important concerns or to alternatives. So what do you see as the most important limitations of that kind of reform?
I think the limitations are one, that we're not entirely sure that they're going to achieve the objectives that they think they will achieve. So I think that the evidence is rather mixed in terms of if we implemented restrictions, that we would see this sort of full wholesale reduction in consumption of banned items. So we don't know that that's actually going to happen. Folks could always use cash to buy those things, and some experiences with soda taxes in different places show us that folks can avoid these kinds of restrictions when they want to. The other side of it that I explore in the piece is this is really taking us in a rather different direction than the global move in the world of food insecurity, which is more toward a cash transfer and further away from things like in-kind food transfers, which are just giving people food products, or food vouchers, which are labeled for specific kinds of food. SNAP's somewhere in the middle right now, but to say that we're going to steer it more toward the side of a voucher system or a more restrictive embodiment of the program is really taking us away from the direction of global work in this space to prevent food insecurity, which is, again, heading more toward a sort of purely cash transfer system.
Looking at that, the global trends, what evidence is there to support those changes?
So in general, the evidence on cash transfer programs covers a lot of different social interventions. So things like achieving a variety of health objectives, educational objectives. Sometimes it's in low and middle income countries, other times in higher income countries. So the evidence is really global and focused on a variety of different kinds of outcomes. In the world of food insecurity, essentially the revelation or the kind of realization is that just giving people cash tends to also achieve the same kinds of food insecurity objectives that more specific targeted programs that are just giving people food or giving people coupons that they can use only on food. We know that those things can reduce food insecurity, but additionally, just giving people cash and letting them use it on food or perhaps other things also achieves food objectives or broader health and well-being objectives that more, I guess, complex or more targeted programs might have been trying to achieve in the past.
Finally, how could SNAP be changed to be more in line with global evidence on food security? Are there any politically feasible options for reform?
This is a really good question because SNAP is always subject to some kind of political debate. It's a tricky thing because it's such an important program for so many millions of Americans, and yet it's sort of always subject to debate. So I think some creative thinking around the program is really warranted. Some folks, like Craig Gunderson has written about this, say we need to just imagine SNAP as some kind of universal basic income program. And we see these kinds of UBI pilots and initiatives in cities around the US right now, and many evaluations are showing promising effects and are ongoing. So that's kind of the most radical re-envisioning of this program, is just make it purely a UBI type program where it's just cash, just a pure cash transfer. The other set of things we can think about are really scaling up the incentives. If we're going to stay within a sort of food paradigm, which I'm not a politician, but would imagine that's maybe the more middle ground argument, is saying how can we really incentivize folks to buy healthy products within this program in a way that doesn't force additional complexities on folks to choose at the level of the household, that making their lives more complex, but rather providing an option to take advantage of should they want to.
Thank you, Dr. Chrisinger.